Baby mouthing, also known as mouth exploration or mouthing, is a natural behavior in infants and young children. It's a way for them to explore and understand their environment through sensory experiences. During this phase, babies tend to put objects, toys, and even their own hands and feet into their mouths. This behavior serves several purposes. 1. Sensory input. Babies receive sensory feedback from the texture, taste, and temperature of objects. 2. Exploration. They learn about shapes, sizes, and materials. 3. Developmental milestone. Mouthing helps babies develop their motor skills, hand-eye coordination, and cognitive abilities. For self-soothing, sucking and mouthing can be calming and comforting for babies. Remember to ensure your baby's safety during this phase by providing age-appropriate toys and objects, supervising closely, keeping small objects out of reach, encouraging safe mouthing alternatives like teething toys or pacifiers. Let's discuss it more deeply into it.
Please subscribe the channel before we continue.
Hello folks, does your baby also put her hand in mouth? If yes, let's discuss about it. It's called mouthing and it starts around 3 to 4 months. So here is the question, do mommies need to stop their baby? The answer is no, because it is a major milestone in babies. What are the benefits of it? 1. Prepares them for solid introduction when baby is mouthing teethers, toys, or even their hands. They are getting exposed to a wide variety of textures, making it easier for them to accept textured food in the future. 2. Moves the gag reflex back and desensitize it initially. Baby's gag reflex is towards the front of their tongue. With constant mouthing of toys, it starts to shift from the front of the tongue towards the back. This makes it easier for the baby to eat later without gagging and vomiting. 3. Strengthens baby's jaw, cheek, and tongue muscles. By mouthing toys, their cheeks, jaw, and tongue are getting lots of exercise. This is important because it makes them stronger so that when they start to eat food, they can easily manipulate that food in their mouth. 4. Helps build a stronger immune system. When they're chewing on these things, it exposes them to the pathogens in the environment. Every subsequent exposure strengthens their immune system to that pathogen, helping their body fight the infections easily. 5. It is soothing. Sucking is actually a reflexive behavior that babies do inside the womb. This reflex helps them feed from the breast as soon as they are born. Sucking activates the parasympathetic nervous system, which helps to calm them. 6. Helps them explore and play. Initially, a baby can grasp a toy and hold it, but they can't move their fingers to explore. So they use their mouth to explore as that develops first. 7. Helps relieve teething pain. One of the symptoms of teething pain is gum pain. A proven way to relieve that is by applying pressure to the gums. That's why they end up chewing their lips, hands, toys to relieve their itching and pain.
So if your baby is continuously doing this, do not stress out. Instead, find a reason to implement the action. 1. Baby proofing. A baby who has recently discovered their hands isn't that far from finding other objects lying around them. So make the environment safe by removing every choking hazard from their space. Reaching out to grab things is probably one of their next developmental stages. 2. Introduce sensory toys. This is also a prime opportunity to introduce them to fun sensory toys like rattles, crinkly stuffies, and cloth books. 3. Offer a teether. If your baby is sucking their hand because of teething pain, offer them a teething toy, cold washcloth, or frozen feeder. 4. Offer awake time play gym, contrast books, tummy time, talking, singing, etc. Do babies grow out of it? Yes. Babies move quickly from one phase to the next, so it won't be long before they've found something else to hold their attention, like their toes. As their language develops, they'll be able to communicate easily. Even if they are a thumb or toe sucker, most kids drop the habit between 2 and 4 years, leaving only a small percentage of kids still thumb sucking after that.
There is nothing wrong with this habit. You should, however, make sure that your baby's hands are clean. They aren't in any pain or discomfort. There are no choking hazards around them. Some people worry that their baby's thumb or hand sucking will interfere with oral development. American Dental Association reassure parents that the behavior doesn't usually cause problems in the first few years of life. The experts say that it's only after age 2 that you may want to start gently discouraging the habit to avoid future problems with the mouth. Although it might seem strange to us, this behavior is actually quite normal. It's a part of their natural development process. When babies are born, their sense of touch and taste are acute, helping them explore and learn about their surroundings. So when you see your little one with a hand in their mouth, don't panic. It's just their way of discovering the world around them. And remember, it's important to always supervise your child during this phase to ensure they're safe and healthy. That's all for today, folks. I hope you found this information interesting and helpful. If you enjoyed this video, don't forget to like, share, and subscribe for more fun and informative content. Until next time, stay safe and take care.